Hello friends, today I will talk about a very important topic, and that is neck pain and back pain due to slip disc or disc prolapse. So I will talk about how we evaluate these patients and then what are the basic principles of treatment. So number one, if you look at what are the common symptoms. So if there is a problem in the neck area, the commonest symptom will be pain in the neck, and also slightly below that what is called as interscapular area. And then if the nerve compression is more, then the pain can radiate from the neck to the shoulder and coming to the arms, forearms, and up to the fingertips. And other than pain, other symptoms can be numbness or weakness. So again, numbness also can affect the same areas, and weakness also, depending on the nerve that is compressed, that part of the hand or the arm can have weakness. So typically these symptoms can be of short duration, like say a few days or few weeks, or it can become chronic when the symptoms persist for several months or even years. If the nerve compression is in the lower back, also called as lumbar region, then the symptoms will be back pain, and from the lower back the pain can radiate to gluteal region, the buttocks, thighs, calf, and up to the foot. So again, it depends on which nerve in the back is getting compressed. The symptoms can be in that area. The pain can get worse on sneezing, coughing, or sometimes walking. When the pain or numbness in the legs increases on walking, that is called as neurogenic claudication. So typically the pain will start after walking say 100 meters or 500 meters, and after taking rest the pain is relieved. Now other than pain, similarly in the foot and the leg there can be numbness or weakness depending on the nerve compression. Now when somebody has these symptoms, then they are highly suspicious of slip disc or the disc prolapse with nerve compression in the neck and the back region. And then on examination we may confirm these findings of numbness and weakness, and also sometimes we check this deep tendon reflexes which may be sluggish or absent. And then there are few examinations where we elevate the leg, when the patient is lying down, and after elevation of the leg to a certain height the pain may get exacerbated. So few bedside examinations are there. They are not specific, but of course if they are positive they also give a lot of importance in diagnosis. But finally there is only one method to confirm this what we are saying, and that confirmation usually it comes with the help of doing an MRI. So depending on the symptoms, the MRI scan can be done for the cervical or lumbar region. Usually it's a non-contrast, so without any dye or injection the scan is done, and that shows the extent of the nerve compression and also the severity. So that brings us to the treatment. So how do we treat? So of course initial treatment is conservative. So in conservative treatment means without any kind of intervention. So if the disc compression is severe or the pain is severe, so few days of rest may be advised, where you have to limit your walking and standing and do only essential activities. And the second part of the conservative treatment is physiotherapy. In that there are treatments like IFT, ultrasound, so various other techniques are there which can be used to relieve the pain. And then third one is medication. So there are medications like gabapentin, pregabalin, duloxetine. So these medications are also effective in relieving the pain due to nerve compression. And then once the pain is relieved, then certain exercises called as isometric neck exercise for the neck and back extension exercise may be advised, so that the pain relief is sustained for a longer duration and pain doesn't recur. So typically about, let's say, 60 or 70% people do have a good relief with these measures, and then slowly the pain is relieved and the person can resume all the normal activities. But in about 20 or 30% of people, when the nerve compression is severe, the relief may not be so good. So there we have other techniques like something called as epidural steroid injections, where some patients do get relief with those injections, but they are short lasting. They last for only a few weeks to few months, and again a repeat injection may be needed. And then if the nerve compression is very severe or the conservative treatment fails, then those people require surgery. And other indications for surgery, if somebody has already neurological deficits like numbness of foot or weakness of foot muscles, So when those deficits appear, it is again better to go for surgery. And very severe cases, there can be bladder symptoms where the person may have difficulty in holding urine or passing urine. So any of these symptoms, one should not wait. And if there is a significant nerve compression in the neck or back, then surgery is usually advised. So depending on the number of disc prolapse or the severity of prolapse, the neurosurgeon would decide what is the best surgery for you. And generally these surgeries are safe, but of course the neurosurgeon will discuss with you the benefits and the risks, and then after understanding everything you can proceed for surgery. So definitely, we have learned few things, and then there are few precautions to be taken when somebody has an active disc prolapse. One is, you should avoid lifting heavy weights, and also this forward bending, which can increase the severity of symptoms. And finally, few points about how we can prevent this kind of disc prolapse in the neck and the back. So number one is our lifestyle, that is sedentary lifestyle. So the more number of hours of sitting and looking at the screen like laptop, desktop or phones can increase the risk. So every 30 minutes try to get up from your chair, move around, and also move your neck. And after 20 minutes of looking at the screen, there is something called as 20-20-20 rule. So look at some object which is 20 feet away for about 20 seconds. Second is something called as exercises. So one can start doing isometric neck exercises and back extension exercises before any symptoms develop. So this can make these muscles stronger, and the risk of slip disc or disc prolapse will reduce. The third one is overweight and obesity. So those who are overweight or obese, they have a higher risk of getting these problems. So definitely weight management is very useful in reducing the risk. And fourthly, if you are exercising, especially in the gym when you have to lift heavy weights, so definitely the technique should be correct, the form should be correct, and you have to lift the weights that you can easily do it. So you should do under guidance of a fitness trainer, because many times we come across people who join a gym and then suddenly they want to lift very heavy weight, and then within few days they come with symptoms of disc prolapse. So that should be avoided. So these are some of the common things one can do in daily life to reduce the the chance of getting disc prolapse. But once somebody has pain and these symptoms what I described in the beginning, you need not suffer, because we have effective ways of diagnosing these conditions, and they are very effective treatments. So you can definitely aim to lead a very pain-free life and do all your normal activities. Thank you.